Good afternoon and welcome to our CGHime-In podcast. I'm Manjit, your host, a nurse by profession. And at our podcast, we speak to individuals and personalities in healthcare who contribute to creating a compassionate care culture. At Changi General Hospital, or our Caring General Hospital, as we are known, our team believes in playing our part to create a nurturing environment. We are here to champion compassionate care, share inspiring stories, and collectively shape a culture of human connection and person-centered care. Today, we are honored and privileged to have Mrs. Maureen Bisognano, President Emerita and Senior Fellow at the Institute of Healthcare Improvement in Boston. Maureen having previously served as IHI's President and CEO, she is a distinguished leader in healthcare improvement, has been a transformative force in advocating for systems that prioritizes patients' needs in the healthcare sector. Today, our topic, what matters to you in your healthcare journey, is an approach that empowers patients and motivates healthcare providers to deliver more personalized and effective care by encouraging and supporting more conversations between healthcare providers and patients. The What Matters to You campaign is today a movement, a global movement that has spread over 50 countries. And hospitals and clinics integrate this question into their daily practice, influencing care models and improving patient-provider relationships. Join us today, friends and colleagues, as we discuss the importance of understanding what truly matters to patients in their care journey and to improve healthcare. Welcome, Maureen, to our warm tropical shores. We are so privileged to have you at CGH. Now, speaking of warm, one of the things you have become known for globally, bringing warmth and also compassion to our healthcare conversation. Before we start, I thought, you could, for us to get to know you better, perhaps you would like to share your personal journey with us, and then, how it all began and what inspired you to, focus on patient-centered care.
Great, thank you. And it's a delight to be here. Wonderful to share some time with you because, as you know, this topic is very passionate for me.
Exactly, yes.
I also am a nurse. Mm-hmm. I started my career many years ago in working in the operating room and then the intensive care unit. And I remember so well working in the intensive care unit. It was a 14-bed unit in a new hospital. And every day I would walk into the intensive care unit and it was completely full with patients waiting in the hallway, patients waiting in the emergency department. And I was walking through a new 14-bed pediatric unit, which was maybe had 2 patients. So one day I went to the nurse leader and I said, why don't we take over the pediatric unit and turn it into a telemetry unit so that these patients aren't suffering as waiting in the hallways and the like. And she said no. And so I went to the head nurse and then to the manager of nursing, and nobody was interested, but I went to the chief executive of the hospital and I described to him the pain that these patients were going through, their families, not being able to be in a comfortable bed, not being able to have their family visit. And he said if I could go convince the pediatricians to move, I could have that unit and transform it. And I did, and it was wonderful to see the impact on the patient experience. And I went on from there to become the vice president of nursing. And then when I was 34, I was asked to be the chief executive of another hospital. And I was 34 and a woman and a nurse, which was highly unusual at that time. But it gave me a wonderful platform to make a difference in compassionate care for all the patients in that hospital. And then I went on to join Dr. Joseph Duran to start a global consulting practice in quality. And then Don Berwick and I founded the Institute for Healthcare Improvement some many years ago. And we've been working globally together to improve healthcare quality and making, I think, a difference in healthcare.
Wow, that's an incredible journey, isn't it? Yeah, from where you started and, what you foresee and how you helped the pediatric unit. And, it made such a huge difference. And now you have this global movement going on. And now coming to that, what matters to you, okay, what in the context of healthcare, Maureen, why is it so crucial for both the patients and the healthcare providers?
Well, I think I've got some family experiences. I'm the oldest of 9 children, big Irish family.
Oh, okay.
And when we were young, my brother, who was the third one in the family, was diagnosed with Hodgkin's disease. And he was going through all kinds of treatment, but at some point in his treatment therapy, I remember being with him in the hospital, and all the doctors came in and stood around his bed, and they all talked to each other. And then they left, but one of the doctors came back in, and he said to my brother, "Johnny, what do you want?" And my brother said, "I want to go home." He was clearly near the end of his life. And the doctor came over and he took my jacket off of me and he went and he put it on my brother and he picked him up and he carried him out to my car with all the nurses yelling, "You can't do that, you can't discharge him, you're not your doctor."
Yeah.
But when I got my brother home, that doctor taught me an important lesson. So I said the same thing to my brother, "What do you want?" And I thought I would give him encouragement, like there's more chemotherapy, there's more radiation. And he said, "The only thing I want is to be 21. And he turned 21 years old on November 25th. And it was Thanksgiving Day in the United States. And we had a wonderful celebration, all his friends there. And then he died on December 1st. But it was 2 weeks of beauty and joy. And we could talk about what he was going through with him. And that doctor asking me that question, "Johnny, what do you want?" that made all the difference in my career.
Right. So that's how it all began.
That's how it all
what
began.
Matters most to maybe to me, to my patients, even to my colleagues or, to anyone that we care about, right? And I think we as, patient experience team in Changi General Hospital also do that with our patients. We discuss their care plans, what matters to them most, or what are concerns. And we actually in Changi General Hospital also do that, especially with palliative care patients, where they want to go home. That's what they tell us, the same thing. Yeah, and then how we, get the palliative or the hospice team to go to their house or and discuss about how to make their end of life more more dignified sort of death with the family, with their the sort of like their own bed, their own family, and around them, the friends, and also little children, you know. And, sometimes they want prayers to be going on and all that give them so much of peace. And, and that makes that end of life not only for the patient, but also for the family, so giving them so much of comfort and sometimes even a nice closure. Could I just also ask you, Maureen, what are some of the challenges that you face in promoting patient-centered care? And, how did you manage to overcome them?
Well, one of the first things was I was flying to Paris to an IHI, British Medical Journal forum, about 12 years ago now. And on the plane, I was red eye overnight. I was reviewing all my slides for the presentation I was going to give. And I picked up a New England Journal of Medicine publication, and I read an article. And in the article, there was one sentence that changed me. It said, "We can't only ask what's the matter, we have to ask what matters to you." So on the plane, I ripped up my whole talk, And I rewrote it with the challenge to everybody. There were 4,000 people in the audience, saying, when you get back to work, I want you to ask the next patient you see, not only what's the matter, but what matters to you. And within weeks, I got stories from all over the world, in Portuguese, from Brazil, from Norway, from Australia, New Zealand. People said, I took your challenge and I asked one patient, and it so surprised me what mattered to them that all of a sudden they started using this as a way to provide care. It started to make a huge difference. And so a movement began those years ago, and still today, people from all over the world meet once a month and share research outcomes, share stories about what matters to you. Some are very simple, like in Norway, there was a man in a nursing home, and he was very difficult. He would fight and never wanted anybody to take care of him. But one of the nurses, one morning when she was going in to bathe him, when she walked in, she said, what matters to you today? What would make today a good day? And this difficult man said, I want to wear my blue shirt. And she said, why? And he said, that was my wife's favorite shirt. And she died 2 years ago today, and I want to remember her. And the whole time she was bathing him, he said how they met and what their life was like and how joyful they were together. And at the end, he said, can you get me dressed so I can go and tell all the other patients about my wife? He had never communicated with them in this way. But those little stories started to make a huge cultural change, where we went from our job as clinicians is to go in and take care of someone, to really partner with them on what matters most, and really changed the whole, I think, dynamic of care in, I think, a very, very good way.
Yes, it does. It does. Our healthcare providers, our nurses, our doctors, we don't only ask what matters to our patients, but also our healthcare providers, especially our nurses who are tasked to do so many things. And, they are sometimes in a difficult situation, and, sometimes with also their own sort of what happened that day, may not be a good day. And to also, I do, when we round the wards, we also speak to nurses.
Yes.
And, we know them so well that we know this person, this nurse today, what's going on with her. So pull aside, talk to her, especially with, some of our foreign nurses where they miss family and all that. So that is also one, some of the, what we do during our roundings in the ward when we speak to nurses and, and become friends. And then if there's anything, they just can call upon us. One of the compassion that we also show, a method of compassion, would I say, to our own nurses, and or even for the matter, even our allied health staff, or even for the matter, our healthcare, cleaners and all that. And it set so much of examples to some of other patients that we also have in CGH. Like, for example, I had a patient who had a very bad wound. He was a very bad diabetic on his calf, and he was admitted for IV antibiotics and to do a IND and then to clean up the wound, and he needed daily dressing and the IV antibiotics. And when I went during my roundings in the ward, when I saw this man, when I asked him, are you comfortable? And, is there anything can I help you? He was just tearing away and asking a bit more. What actually made you so emotional? What did I say? Then he mentioned that, I have a non-ambulant mom at home and a mentally challenged sibling at home, and I'm the sole breadwinner. And I would, I can't be staying in the hospital for so long. So what we did was, got community servings on community nursing service on board, and then the ID consultant is in charge of him to discharge him the next day, and we got the nurses to go to the house to give the IV antibiotics and also to do the wound dressing. The satisfaction I got and the way he was like thanking me, holding my hand and shaking, and that made a whole lot of difference, because if you connect with the patient, you listen to them, and then not only that, I think it's also they feel it, they can hear you, and they know you are genuinely concerned about them. So this is one or two stories that I can share with you. We also would want to inculcate more into our practice what matters to you, to our patients, or even for the matter their caregivers or their family.
Oh, I think it's so important. I think now I'm seeing around the world that it's becoming daily culture, a compassionate culture. And we're seeing different ways to do it. In some cases, whiteboards at the end of the bed. And it says not just what's the patient's diagnosis or what test they're going to have today, but what's their pet's name and what's their family's name. And it allows for different conversation when people enter the room, and really what matters to them. Oftentimes it's very easy to do. People are afraid to ask because they're afraid that the patient's going to want something beyond their control. But most oftentimes it's something very simple, and it's demonstrating compassion that you ask and that you act. The other thing we're seeing is that asking the caregivers is just as important. They're often so stressed and so worried about, can I do this at home? And asking them what kind of support they need. And I think perhaps even most exciting is asking teammates, asking fellow nurses. We're finding that all over the world, especially during COVID and during times of stress, when leaders are asking nurses what matters to you, it's oftentimes something simple that can really make a difference in satisfaction and joy in work. And that makes all the difference to compassionate care. I think compassionate care is directly linked to outcomes. What we're finding is in the story that you told, is that oftentimes when we ask the question and a man wants to go home, that kind of compassionate care is really around the world producing better clinical outcomes because the patients are involved in their own care. They're able to communicate what matters most to them. They're able to, it gives them courage to say, I have a need, or I'm concerned about this, and the conversations change. The same with staff. What we're finding is that when leaders ask nurses, as an example, what matters to you, they're finding out more about the person, not just the nurse as a professional, but the nurse as a human. And that's changing the way that we're interacting. You mentioned housekeeping staff. I was recently talking to a young man who was an environmental services worker, and he told me that he had been called to human resources and told he was being fired because he had been absent too much. And when he went down to his environmental services room, he opened up his locker to clean it out, and he started to cry. And one of the other environmental services workers said, what's the matter? And he said, I've been fired. And she said, why? And he said, because I've been absent too much. And she had heard all the nurses say, what matters to you? So she said, what matters to you? And he said that he was going through a difficult divorce, and he had to go to court to fight for his 5-year-old son. And he said, he's what matters to me. And so the young environmental services worker, she created a different staffing method based on what matters to people. And she went to the head of the hospital and said, if I promise you that we won't cost any more money and we will staff every unit every day, will you let us make the staffing based on what matters? And it totally changed the culture of that whole organization. Wow. A simple story of asking what matters. And that's what we need to do with our staff. They're people. They're not just housekeepers or nurses. They're people. And we need to recognize that.
Yeah, thank you for sharing that. And that's actually an incredible outcome. I'm now talking about the role of technology, AI and all that. How do you foresee technology enhancing our patient care experience and, improving healthcare delivery?
Well, it's a very exciting time, isn't it? I mean, on the one hand, it's a little daunting to think about technology because it's not easy for somebody who's been very hands-on and compassionate in person to adopt the technology. But I'm actually very, very excited about it. In the United States, as an example, in some hospitals now, they have little robots that do all of the technical things. You probably have them here too.
Yes.
When a nurse needs to draw blood for a patient, the robot goes and gets all the equipment, brings it to the bedside. The nurse draws the blood, gives the blood to the robot. So the nurse never has to leave the bedside. And that accelerates the human interaction. It's not just running out, getting things, running back, it's I'm here with you, and that's compassionate care. So the more we can interact with technology, with AI to understand the whole person, I'm really excited because I think it's going to actually enhance compassionate care.
Yes, exactly. Yes, we do. I mean, we also have robots working with us in the wards, especially in our geriatric ward, where when the patients are all, gathered around, and we have a robot, just with music and all, teaching them how to do just simple exercises like raising their arms up in the air and then down, and then, moving their shoulders, and, they all enjoy it. So, yeah, I mean, the role of technology has played an important part, or it actually enhanced a lot, of our patients' experiences. Maureen, what advice would you have for providers, our healthcare providers, who wish to implement more patient-centered practices in their work?
A lot of times people tell me that they're afraid that the patient is going to ask for something that they can't do. And they're afraid that that would be the opposite of compassion.
Yes.
And so I tell them, just try it. Just try it with one patient. I think that when you try it, you'll oftentimes find it's a blue shirt or it's something simple that really matters to someone. When you give them the opportunity to express that and then you can follow through, it makes all the difference in the world. So I would say just try it. Then once you begin to build the will and begin the competence so that people start to do that, you can build it into your daily rounds. As an example, you can talk to staff and ask what matters to them. When I was the chief executive at IHI, as an example, I would start every leadership meeting by saying, tell me one good thing. And they would just talk about their lives, and we get to know them as people, not just the head of HR or the head of finance. But it's opening those doors, that understanding people and where they're coming from, that I think makes all the difference for us. I've been in healthcare for my whole life, and so I think that it's in my heart and it's in my head. But if I had a choice to do something different, I would go out into the community and I would try and take a look at what does the health of the community look like? Is there a way that we can reach beyond the physical hospital or clinic and look at what are the key drivers for health? Is it housing? Is it social isolation? I'm having such fun around the world working with people who are setting up new ways for people to connect, just to eat together. At Mayo Clinic, we call it commensality. Commensality, eating together. Just bringing people together to decrease social isolation, I think not only has a tremendous impact on psychological well-being, but also on physical well-being. So I think I would reach beyond the walls and look out into the community and just say, are there new ways that we could work together with food and with community centers and with exercise and walking in the woods and all those things. I would bring all of those things together for better health in our communities.
Thank you, Maureen. You have reminded us that healing begins with what we ask, and the importance of genuinely listening to what matters most to each individual. And friends and colleagues, as we wrap up today's episode, I hope you have not only gained a deeper understanding of what matters to you, but also the motivation to take action no matter how small the step. Until next time, keep showing compassion, keep listening, and keep the conversation flowing. Thank you for tuning in.